Hello everyone, we are delighted to introduce you to Dentospedia, the leading platform specifically designed to help you to excel in your dental board exams. So today we are going to study a short topic on ART, which is very important from the expected dental board examination, which is Atraumatic Restorative Technique from the module of Dentospedia. So let's get started with the topic. So see, ART is a technique used to assess or prevent dental caries by removing soft demineralized dentine and enamel using hand instruments only, followed by filling the cavity with a glass ionomer cement GIC which releases fluoride. Understand? So see, there are some key principles of ART. See, the philosophy of ART, which is Atraumatic Restorative Treatment, is based on the concept of minimal intervention dentistry. Understand? MID, which is minimal intervention dentistry. Understand? So see, the procedure is performed without the use of an electrical dental drill, rotary instruments, or local anesthesia in most cases, making it less frightening and more acceptable for children and patients with dental anxiety. Only the soft, infected tooth structure is removed, preserving as much as healthy tooth tissue as possible. Now see, the restoration material used, like GIC, bonds chemically to the tooth structure and releases fluoride, helping to remineralize the surrounding tooth structure and prevent current decay. Understand? Instruments and materials used in ART, atraumatic restorative treatment. So these are some of the basic armamentarium, which are mouth mirror, which is used for visualization, explorer or CPITN probe for detection of cavities, spoon excavators for removing soft caries dentine, dental hatchet for enlarging the cavity walls, cement spatula for mixing the restorative material, that is GIC, applicator, a plastic filling instrument for placing the GIC into the prepared cavity, gloved finger or press tool for finger press technique to adapt GIC. So see, these are the instruments for ART: mouth mirror, tweezers, explorer, hatchets, chisels, and understand? So see, the material used. So the material used is high viscosity glass ionomer cement. It is used for restoration, and also GIC has a unique property that it releases fluoride. Understand? Now cavity conditioners like 10% polyacrylic acid is used. Why? Because it clears or cleans the smear layer. It cleans the smear layer and improves the bonding. Now petroleum jelly or varnish is applied over the restoration. Why? Because it protects the restoration from moisture contamination during setting, and also it prevents disintegration of the GIC. Understand? Now cotton rolls or gauze pieces for controlling moisture. Understand? Now plastic strip and matrix band for proximal lesions if needed. Understand? Now next is the procedure for ART in children. See, the procedure is simple and can be carried out in a variety of settings, even outside the traditional dental clinic. So first is isolation. Understand? Now the tooth is cleaned and cotton rolls are used to isolate it and absorb saliva. Then is access and removal. Understand? See, a sharp hand instrument like gentle excavator or hatchet is used to gently remove a soft carious dentine until a firm hard base is reached. Understand? Then what you have to do, you have to condition. Then conditioning is done. The cavity is conditioned with polyacrylic acid. Understand? Cavity is done with conditioned with polyacrylic acid to prepare the tooth surface for the chemical bond of the GIC. Now for conditioning, 10% polyacrylic is used for how much time? For 10 to 15 seconds. Understand? Now mixing and placement. Now you have to mix GIC powder liquid. Understand? Now you have to mix the GIC powder and liquid and insert it into the cavity. Understand? Then you have to place the cavity using the applicator or using the plastic filling instrument. Then you have to use the finger gloved press technique. Understand? The pressure is applied usually by the dentist's gloved finger with Vaseline to ensure the GIC is well adapted to the cavity walls and margins. Now excess material is also seal the adjacent pits and fissure. Understand? Then finishing. So see, the material is allowed to set and excess is removed. The restoration is then protected from moisture with petroleum jelly or a coating material. Understand? Then post-op instructions. You have to avoid chewing on the restored site for 1 hour. You have to ask the patient to not to eat or not to chew from the restored site for at least 1 hour. Understand? You have to educate the parents on maintenance and follow-up. Now see, this is the procedure. You can see mouth mirror and uh, this is excavation of caries with the help of a spoon excavator. Now mixing of the GIC and placing of the restorative material. Understand? You can see GIC powder and liquid. Now see the indications for ART. So it can be given in uncooperative or anxious children. Understand? In community-based or field industry. Are you getting the point? Teeth with early to moderate cavitated lesion and where electricity or equipment is not available. Understand? It reduces the pain and anxiety. So no injection is required. So it is ideal for uncooperative children. Now it is of minimal and low cost equipment. So it is ideal for outreach or public health programs. Now GIC releases fluoride promoting secondary caries prevention. So can be performed in schools, camps or community centers where electricity or water may be a scarce. Understand? So contraindication, it cannot be used with lesions with pulpal involvement or pain. In extensive caries, it cannot be used in swelling, abscess or mobility, in fractured teeth or in unrestorable teeth with poor prognosis. Understand? It is limited to small and medium sized cavity. It requires good isolation. The procedure may be slower than using a drill. Understand? Now see, GIC has a lower strength and wear resistance compared to composite or amalgam. The clinical lifespan of the restoration may be shorter than conventional filling, especially in high stress areas. Understand? So that was ART, Atraumatic Restorative Treatment. So for more such kind of detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.